All right, let's see. So the agenda for today, roughly, and we can go off topic if you like. I don't mind changing it up as we go. But we'll have a quick introduction of myself. Then I'll have some common lingo from a security side of things. I know we use a lot of acronyms and buzz terms, and it can be confusing for people outside of the cybersecurity industry to understand what we're even talking about half the time. So a little bit of some common things so that at least we can understand each other a bit better. Then I'm going to move on to cybersecurity concerns as they relate to research. So some of the challenges that you guys may face, and other industries face similar challenges. And then we'll look at some kind of questions in that of what you guys need to know as researchers. And feel free at any time to ask questions or, anything you see on the slides. So who am I? It's a great question. Some of you may recognize this gentleman on the screen as Mr. Robot. He's a popular TV hacker these days. That is not me. Obviously, and I'm not wearing a hoodie today, as you can see, so I don't fit the normal mold. So I'm not a hacker. I focus primarily on defensive technologies. So I teach inside the cybersecurity program at NBCC here in St. John. And I teach the technologies, the processes, and the people awareness that companies and teams need to have in order to protect themselves from the bad guys. Although he's a good hacker. We could debate that. Feel free to debate that with me. So along the common language, when we talk in cybersecurity, and sometimes IT in general, but specifically cybersecurity, we always bring things back to these three words. So confidentiality, integrity, and availability. And we kind of call it a CIA triad. It's not a government thing. It's not the Central Intelligence Agency. We're not spying on you guys. But these basically allow us to think of our software, our hardware, and our people, and look at different ways that their confidentiality, integrity, or the availability can be compromised. So confidentiality is pretty common. I think a lot of people think, oh, that's privacy, personal data, healthcare data, making sure you protect that patient confidentiality. And that's where a lot of the regulations and government rules are around that you guys know, that you need to protect that data. But when we get into integrity, a lot of people start to ask questions, but what do you mean by integrity? And it's not my personal integrity, it's not your personal integrity. It's integrity of the information. So the way I like to think of it from your environment is you need to be able to trust your data. So you have to know that it is correct, it hasn't been modified or tampered with. So keeping the integrity of your data is critical as well. And the last, availability, is just, it's there when you need it, really. So if you're in a situation where you're trying to make a decision or a medical decision, if you don't have access to your information, you're compromised, right? So a lot of times in the news, you might hear like a denial of service attack, which is basically they send a lot of traffic towards a website, crash it because it can't handle all that. That's a compromising of the availability of the website. They're not corrupting the data. They're not stealing the data. They're just making it unavailable. So those are some general terms. And you'll see those as we go through the rest of the slides. So now that we've kind of talked a bit about some common terms that we can use as we go through the slides, I thought it'd be good to just kind of level set and talk about the industry in general, some of the pressures, especially around research and healthcare. And the first slide that you see here is a graph pulled from the HIPAA journal in the US from August 2019. And what it's really showing you is the number of breached records. So not an individual compromise, but how many records were stolen, individual patient records. So it's kind of disturbing when you first look at it. Starts in 2014 and it's nice and low, we like that. 2015, there's a huge spike and people would likely say, why is there a spike there? And I'll get to that. But the other important thing to notice is it's trending and it's not trending in a good way. It's trending up, right? And this is only as of January to August this year. So half of the year. And we're already well above the previous year's values, right? So before I get into kind of maybe why, but that breach there in 2015 that jumps the numbers up, that was actually one breach. And it's kind of important to think of because it wasn't a fancy hacker doing things. It was an exploit that the bad actors or the hackers basically did a phishing exercise, which if you're not familiar, it's those emails you get, nuisance things like, click this link because you have to approve a PO or something like that. So someone will click the link, that goes out to a website, downloads malicious software, and then they've compromised your laptop. So from there, they can then move across the organization. So that's actually what happened here. There was one company that actually contributed to over half of those records, and they clicked a link in an email. The bad side was they clicked that link, and for several months, no one detected that someone was inside. So they pulled records gradually, slowly over time, and they got many records. So inside that HIPAA journal, they mentioned a few kind of key contributors to why there's more breaches of healthcare records. And one that stuck out to me particularly was around external partners. And that to me, and when you guys think of an external partner, I think of it as like one of your research collaborators or another company that maybe is selling you software to collect healthcare data. They're your partners, they're your external vendors in a way. And this here stat showing that compared to other industries, in healthcare, you actually don't vet those partners as aggressively as other industry sectors. So say like power and utility. Again, this is the US, so take it with a grain of salt. Could be completely different here in Canada. But I'll jump to the next slide, and we'll try to get a little more Canada focused. So what you're seeing here is information from the 2017 Stats Canada survey, where they went out and interviewed IT and security managers in various companies and industries and collected information on what cybersecurity controls or measures they have in place to protect their companies or their data. And so in general, if you look, I pulled in the all industries average as the blue. The utilities industry, which is an interesting one, we hear a lot about critical infrastructure in the news these days, power, distribution, water. A lot of those tend to be your critical industries and fall under utilities. And then healthcare. So this is healthcare in Canada, but it would include hospitals, it would include ambulance services, any of your standard partners that help provide healthcare overall. And some of the interesting things you may note is that healthcare seems to be on average with most industries, but not the best. Not as good as the utilities companies, which I would consider critical infrastructure, but I also consider healthcare and the patient data critical infrastructure as well. So when you think about this, and that's why this little guy is sitting up there, I think about why. And that's an important question to ask yourselves, but also people in the healthcare community with you, and ask, why are we just average compared to like a private company? Because inside here, there would be transportation companies, all industry verticals in Canada. So only on average with them. It's kind of, I would say, some concerning numbers, right? And feel free to ask questions. We can zoom in on these. They're individual measures. The next slide, I pulled out one that was of interest to me.
Is the federal government there?
The federal government is a good question. I don't know if it falls into this category. They were surveying like outside industry. I don't know if they turned the lens internal on themselves or not. Good question. I wish I had the answer. I'll look that up for you. But some of the general things, and these are kind of wordy, but like mobile security, so managing your mobile devices, making sure they're secure and they can't be compromised. So you can see here how, in that particular control, how the industries compared and how healthcare compared. The interesting one, which is on the next slide, there's many interesting ones. But to break it out and look at data particular, in data protection is what we would call the whole spectrum of how the data is managed and taken care of in your company. So data protection, slightly better in healthcare, which is good, than the industry average of 34. So 38.4, a little bit better, still concerningly low. And then kind of the high watermark being utilities, 57. So what is data protection? Well, here they talk about encryption and rights management. So you guys probably know what encrypting your data is, and you hopefully use encrypted USB drives, and hopefully your laptops all are encrypted. But it can also extend well beyond this, because encryption and access control or access and rights management are kind of the basics. So basically, is your data encrypted so that if someone does get it, they can't read it? And then who's actually controlling who can see that data? So in a big company, there's usually an internal IT group. You guys would have an internal IT group. So when someone joins a research team, they're given access to certain files, certain folders and systems, obviously, right? That's all that rights management process. So encryption rights management obviously still needs more work. So an area of opportunity, I would say, or as some people call it, an opportunity. What I'd like to extend on that, though, before we leave this data protection specifically, is it can go well beyond those. So in a military environment or a government environment, the data itself can be beyond just encrypted. It can be tagged. It can be tracked. So if someone tries to email a file that contains patient data, that can be blocked automatically. There's a lot of controls in data protection. And it should be questions that you kind of ask, what are our data protection policies? So what are we supposed to be doing? And what are the controls that make sure that that's actually, that policy is being followed? No questions on that one? Challenges. And I don't presume to know all of your challenges because I don't work in research. But there's always pressures to improve patient outcomes. There's always pressures to reduce cost. And these are pretty common, right? So drive up productivity, drive out cost. These are continual pressures, right? Do things quicker, faster, better, right? And so these drive changes. And one of the highest risk points in any program or company is when change has actually happened. Because things are being modified and maybe they're not modified properly. So keep that in mind as well. Also, cybersecurity is a complex and rapidly evolving area. So even in my world teaching, I have to basically update my curriculum. I could update it every month, but that would be exhausting. So I try to at least update it every 6 months. And that's because there's new things that we hear about, new vulnerabilities in our systems, new types of attacks that people are using against us. And really, if you're outside the industry, it's very unrealistic to expect anyone to keep up with them, right? So it's a challenge. You're kind of told, protect the data, but it's a very challenging proposition. And then lastly, healthcare is seen as a opportunity for many companies to move into. So the people that come to you and ask to do research with you, they're obviously trying to develop products or services or maybe even traditional drug companies. So they want to work with you. There's a lot of new companies that aren't traditional healthcare companies that maybe aren't even familiar with your normal data controls. And so these companies come in and they may not have the right security inside their company, and that causes an exposure for you guys. So these are some of the challenges. And feel free, if there's more, holler them out, and we'll see if we can address them. But we'll go through some questions and kind of see how can you kind of at least be aware of what you need to do to help protect your data and your research information. So as we jump into kind of the questions, I do have a little disclaimer here. Service New Brunswick, I think, provides IT services to you guys. I haven't checked what their policies are. I don't pretend to know what the controls they have in place. But any of these questions you could actually discuss in a forum between research and IT. And really the goal would be to come up with a good collaborative product that you can share with your research partners to say, these are our policies, these are the mandatory things you need to do. And that can be something that's a public document that you can share with people. Right? So you can certainly collaborate, expand on these questions, and it would be a very valuable asset for you guys to have. So, but if you're talking directly with a company that wants to do business with you guys or research, the first thing you can kind of ask is, how do you address cybersecurity inside your company? Very broad question. But if cybersecurity is important to that company, they should have a very quick and relatively standard answer to what you might see here. So valid responses, you should hear things like, security is an integral part of our product lifecycle, from design to when we release the final product. If you don't build security in the design phase of any product or service or trial, it's going to cost you either more money or a compromise later. It's more expensive to add down the road, right? So they should say right from the beginning, we have security as an integral part. They might also say words like we manage our various cybersecurity threats through our risk and vulnerability management plan or process. So most companies and most people know when I say risk management, it's a standard process. The hospital would have a risk management team. IT would be part of that. They'd feed IT risks into the overall risk to the organization or the hospital. But for vulnerability management, it's a bit of an IT and cybersecurity specific thing because we know at least what the known vulnerabilities are. We know what the weaknesses are in software, certain hardware, and we can manage those if we manage them. We can mitigate those risks, right? So they should know their vulnerabilities and they should have a process for managing those. So another question you could ask is what are your internal standards for software and hardware development? Which industry or government best practices do you follow? IT is not the Wild West it maybe used to be. We are very standard now in our approaches. The standards usually don't make sense to people outside of IT, but we have documented best practices from various government agencies. For instance, the Canadian government has a Cybersecurity program they just launched, and it's targeted for small and medium-sized companies or groups so that they at least understand what the best practice is. And it's actually a certification track. So they can be evaluated by a IT company to say, yes, you meet that standard. The US government has had it a bit longer. The US government actually makes it law. They say, if you want to sell products to us, be it into healthcare or military or just government in general, you have to be compliant with these rules and you have to be audited every year.
Are those ISO standards or?
No, but I do have that on the next slide.
Oh.
Good point. These are the government ones. So, and there's other things that IT does, and it's kind of like open data, open source. We have a lot of non-industry, non-government, kind of just community projects that give us our best practices. So if you're specifically a software company, they could reference like the Open Web Application Security Project. We teach this in our class because it actually is a good way to train your developers in your company to design and develop code in a safe way, in a secure way. And it gives them an entire grid of things to check for, things to, and examples of how to write code properly versus insecure. So they're working hard to make sure that the software is secure. And then the government's trying to say, okay, there should at least be some standards for beyond just software, your whole company process. And that's kind of where you get into ITIL. Yeah. I think it's 2 slides down if you can bear with me. Yeah. You could also ask them to provide evidence. And they're not probably going to be overly keen on giving you their entire risk list for their company, but they should be able to provide you at least something. And if they can't, then they're not probably managing that risk, right? So any good company should say, yep, we've got that. I can give you a subset of it in 20 minutes. Should be ready to go at any time. You have a question?
I was just thinking, what does that look like if you're...
Yeah, well, it's usually in a company when you're doing IT and cyber risk, you list all your hardware assets, all your software assets, your information or data, and your people. And then you have a lot of different categories of what the risks are, and then you have to assign them a weight and a probability of occurrence. And between the impact or the weight and the probability, that puts it to the top or bottom of your list, right? So it should be a nice hierarchical list of the biggest impacting items that could hurt you as a company. And they should have that. We teach that course in 45 hours if you'd like to take risk management. I did it in 3 minutes. So. The next question. Oh, yeah, there's 2 more slides down. Can you provide evidence of your risk and vulnerability management plan? The answer should be yes, as I mentioned. And they should be able to give you a subset. So what internal or external security audits do you perform? Now, a lot of small companies maybe don't do full external audits all the time, but they should. And some of the valid answers they should provide here we do continuous security monitoring and auditing of our own systems. They should tell you right away that they do it themselves all the time. And that might be a fake answer and the quick response, but that should be their quick response. But then they should be able to tell you that yes, and we're audited against third-party standards, and third-party auditors come in. So how often or what application security testing is performed on the application level? So not just security as a process, right? So some of the valid things you might hear back is we do regular testing as a formal part of our change management process. So if any company comes to you and says, yeah, we're going to release a new update every month as we go through this like design phase, you should say, great, what's your testing? What's your security testing? Because as they go through each of these releases, they should be tested. And then it's not really realistic to have third-party audits every release, but on an annual basis, they should be evaluated. And this is actually also part of a government initiative as well. So the Canadian government and the US government will certify software for use in their environments on an annual basis, or whenever they do a new major release. So there is a whole methodology behind validating that. I think the ISO one's next. There it is. So beyond just the technology testing, because that's kind of how you're testing your software, how you're testing your tools and your people, you might ask them how do they test their security standards, and how are they certified to anything. So a lot of times you'll drive by a plant and you'll see big ISO certified banner on it because they've been ISO certified. It's a generic international standards organization, but they also have IT people, process, and technology auditing that they do, and that's ISO 27001. So there's obviously several thousands of these, but for IT specifically, this is it. And it's an annual process, and it doesn't necessarily go in and say, is that piece of software secure? What it does is it says, what are the controls that you say you do to protect that software or data or any asset for that matter? And then it tests to make sure that you're actually following the processes you say you're doing, right? So that's what ISO is, right? I jumped ahead. This is the last question. So the last question, I think, and has your solution been tested by anywhere else? So a lot of times, you guys would trust probably other hospital authorities if they've used certain software or certain technology that you guys would accept it as being already certified by them. You have to be careful with this because it is a trust relationship. So it's not my favorite question, but it's a good indicator. So it's not 100% that you're safe, but if hospitals in Ontario are doing it and hospitals in Nova Scotia and PEI and everywhere are doing it, hopefully someone's vetted it. You still want to ask questions. You still want to maybe ask for proof of what they did for testing, and check that with the references. Don't just believe them. Oh yeah, we used it with 100,000 patients in Ontario. It's perfectly fine. You want to check the reference, right? I'm almost done. How am I doing on time? Good. I guess I didn't have 60 full minutes of data like I thought. So in summary, and please, I'm sure lots of questions, and I even have some questions at the end, but I'd love to hear questions at the end. But in summary, leverage your internal IT staff. They do have professionals that focus on cybersecurity, and it could just be a matter of making sure that the right people are sitting around the table to come up with that common approach that you guys would use, right? And maybe it's already there, and you guys just need to update it or add new components, right? Because it does change quite often. Be aware of the risks and be diligent. Sounds kind of lame, but it's true. Know what the common things are. So even every year, there's journal articles that publish, like, what's coming down the road. What do we see happening in 2020? What do we see happening around cybersecurity in the next 5 years? And it's not fancy stuff, most of it. The biggest point of attack is still going to be phishing, because secure companies or groups usually still have a pretty hard external shell or perimeter, so it's hard to get in. Why the phishing emails work is because you allow email through because you need email. And then outbound traffic isn't monitored as aggressively as inbound traffic. So they get that link to you and you click it and your external perimeter says, yeah, that's okay. They're just going out to the web. They always go out to the web. So it eludes most of the controls that are in place, right? So that's still going to be one of your biggest exposures. And there's fancy phishing, like spear phishing, which is when they target. Like, oh, we know they're researchers. They probably have access to healthcare data. Oh, that's the research coordinator. Let's send emails to her or him and try to get them to click the links, right? So be diligent. And there's training. That's why I say provide training. There's actually a lot of companies now that will train or provide even material of just how to identify those suspicious emails, because they do get better at making them look like real email. They're not all asking you to give $10,000 to a prince, and they're getting better, right? More targeted, right? They even do fancy things that you should be aware of, that when you're browsing like a healthcare research site, if a hacker is targeting healthcare, they could place malware on those websites, and you could actually, just by going to the website, infect your computer. Call it water hole. That water hole is where you guys all go to drink, because you like to drink for knowledge. And they're just waiting there like a lion to grab the poor researcher, right? It's very common in all industries, right? So hopefully your IT people are putting controls around your browsers on your system so that they can detect most of that and block it. But it's going to be one of the still most prevalent ways that people try to get into your data. The other, just, for instance, and it's kind of a sad thing, but ransomware is still projected to be one of the biggest problems in 2020. And not just what we see today. They're seeing evidence that criminals are actually collaborating more and building more and more sophisticated ransomware attacks. So they get your data, they encrypt it. You don't have access to it until you pay the money. They hold it ransom. You probably heard, and some of the cities are experiencing this in the US and even in Canada right now. There's one in the Northwest not too long ago. I think it was around child welfare data, actually. So they encrypted it, and then they weren't releasing it until they got paid. Scary. But probe your partner's security practices, those questions, having a common criteria for them to engage you, minimum requirements, that kind of thing. Make sure you're vetting your vendors or your partners in whatever form they take, right? Hardware, software, data collection, wherever they're helping you out. Make sure that you're diligent there. And then when in doubt, and there's always doubt, but you can actually request audits. There's no company out there, I assume, that would want to work with you guys, that if you said, do you do security audits? And they say no, and you say, okay, well, you need to do one. And we won't work with you until you do. It's perfectly valid. Many companies do that today, and they do it to protect their supply chain. And your partners are part of your supply chain, effectively, right? So it's not uncommon. You're not being, super strict, saying you need to audit. It's okay. Make them provide proof to you guys that they're doing the right best practices. And that's all I have for slides. Thank you. Any questions around the room? Yes.